If you're uninsured and considered high risk, you could be eligible for a new affordable insurance program. Today, officials unveiled the Health Insurance Program, or HIP, at Spectrum Hospital downtown. The program gives insurance coverage to people in Michigan with pre-existing conditions such as cancer, diabetes, or heart disease. HIP is part of a federal program run by the Department of Health and Human Services.
Thanks, Sue. Joining me in studio now is Marianne Sesti with the HIP Michigan program. And Marianne, this is part of the larger overhaul of health care and health insurance. A lot of it was a health insurance overhaul that was argued about in Washington. And this is one of those programs that is going online before 2014 when a whole lot of this will start. So tell me what this means. So let's start with who qualifies, because you talk about pre-existing conditions. And for those of us that are not in the medical field, we don't know what that means necessarily, because all of us have a pre-existing condition of some sort.
That's true. Many pre-existing conditions, however, will preclude you from getting insurance. We had an example, and you might not think of this, but pregnancy can be considered a pre-existing condition. Someone does not have insurance, goes to get some insurance, maybe on the individual market, is pregnant, and then is told, well, we can't cover you because you have a pre-existing condition. Pregnancy, hypertension, heart disorder, cancer. You're right, it could be many diagnoses.
And it would vary from insurance company to insurance company of what that pre-existing condition. So there is the possibility that you can shop on the open market, but we also know that there are some things that you're just not going to find a policy out there. So who would qualify for this? This would be anybody who meets what criteria?
First of all, you need to be a Michigan resident. You need to be lawfully present in the United States. You have a pre-existing condition and you have been uninsured for 6 months, and you're able to pay the premium that is associated with the insurance program.
And that would be the big question for folks. What is that premium? Because we know when some of this began, there were these plans made for people with pre-existing conditions, or some insurance companies were putting plans out there that weren't affordable. So what are the premiums here?
Well, they range from $171 for a child up to about $600 for a 60-plus individual. But they also vary according to the deductible that you might choose, similar to what you do with an insurance, auto insurance. Yeah, maybe my premiums will be a little less, but I think I'll take a higher deductible. So we have 3 plans that vary on the monthly premiums, and they vary only by the deductible, not by the benefits. The benefits are the same.
Bottom line is, there are a lot of people out there right now that are saying, hey, look, this may be the thing that I've been looking for. I haven't been able to get insured. So they can go to hipmichigan.com.
Correct.
Or they can call the number that's on the screen right now and get in touch with somebody there. They can explain the program in detail. Thank you for coming in.
You're welcome.
We appreciate your time.
Thank you very much.